Okay, we are with Dr. Philippa Whitford, SMPMP for Central Ayrshire. Thank you very much, Philippa.
You're welcome.
Okay, first of all, of course, my questions are about the COVID-19. And my first question is, how is the Scottish NHS and Scotland in general coping with this crisis?
Well, I think because the UK lockdown came a little bit earlier on the rising curve in Scotland, we've actually begun to see quite a significant flattening of new cases and also stability of people in hospital and a slight reduction of people in intensive care. So we've actually kind of flattening the curve, as they call it, in Scotland. And in actual fact, our hospitals, certainly the hospitals local to me, did an amazing job of remodeling the entire hospital system within a matter of about a month to get ready for this. They managed to increase their critical care capacity by about more than 4 times. And, you know, they have spaces, they have beds, they have about 300 beds that are free at the moment. So hospital-wise, I think the NHS is in quite a good place. The challenge we have is in social care and in the community and care homes. And that's part of what I'm trying to work on at the moment back in the NHS, is trying to help us link up and see how we can support colleagues in the community and in social care. And I think the challenge going forward will be all the things we're not doing that we would normally be doing. And I think this is likely to go on for some time. So we will actually have to find ways of continuing with the most important work, particularly around cancer, etc., that we would normally be getting on with.
The situation is quite different in the rest of the UK, for example, in England. What kind of challenge the UK has now?
Well, I think, you know, we are seeing a kind of slowing in new cases. I mean, if you remember, just before the lockdown, it was really an accelerating exponential rise. That is leveling off. I think one of the issues in England is still the structure in the NHS, which is much more fragmented than in Scotland because of outsourcing after the Health and Social Care Act. Things like the provision of PPE, which in Scotland, the issues in the first 10 days to 2 weeks were around distribution, because we actually have central procurement and NHS delivery, but suddenly they were having to deliver to places they'd never had to deliver before. In England, it's the companies who tend to hold the stockpile, etc. So again, it's been much more fragmented. And clearly what we're hearing is even people in intensive care, which is the most high risk area, being told there might not be enough gowns for them, and the guidance being changed. And obviously that's incredibly worrying when we've already seen so many health and social care workers lose their lives to this.
I think that you were tweeting about the UK government when published the data and advice is using to guide its COVID-19 response until the pandemic ends. Why? What's that all about, Philippa?
Well, to me, it's a little bit worrying because it sounds as if they don't want any challenge or debate. Now, I can accept that decisions that have been made and are passed, you might say, well, okay, we'll hold you accountable in an inquiry afterwards. But some of the decisions that have been made and are being made have an influence for what we do next. So particularly around the abandonment relatively early of testing, contact tracing and isolating. The announcement was really on the 12th of March that they would stop largely doing that, and yet lockdown was not until 11 days later. So we're moving into the delay phase, but not an enormous amount of action. We will only get to come out of lockdown if we have testing, contact tracing, and isolating up and running. So I think it's important that the evidence, that the decisions around how we go forward are shared a bit more openly. Whether they're shared with the public, you can argue about that, but they should at least be shared with a wider group of scientists. There still seems to be a limit on the amount of public health expertise that's involved. So to me, I think they should publish what they were making decisions on so that we can weigh up the kind of way that they are making decisions, so that we recognize as we go forward. Because actually the decision coming up next, which is how you ease lockdown, over what time scale, and when you even begin to think about it, are utterly critical. And therefore, it is important that this is not just a decision that's made in a little closed room and then announced to the first ministers of the devolved nations inside a COBRA meeting with no input to that. I think that's to be avoided. And I think a wider group of scientists and public health experts would actually help to make that decision a better quality decision.
Here we are talking about the importance of the test, and there's the massive tests. And there's a lot of doubts about, and I would love if you can help me with this. Because you're a doctor and you can advise us. So are people developing immunity? For example, is one of the questions of, if you are immune, will you still test positive? And the other question is, how is, if you're immune, do you need a vaccine, for example?
Well, these are different types of tests for a start. The test that's being done at the moment and needs to be massively scaled up is what's called the PCR test or antigen test. It's looking for little bits of virus to say that you have the virus infection now, and therefore you need to not be in contact with other people. And therefore, when you find someone who's showing the genetics of the virus, you want to find their contacts, test them, or advise them to isolate. So that's the testing that we have at the moment, but that we have to scale up massively. The other test, which obviously people are keen to get, is the antibody test. Antibodies are part of your immune response. And for many conditions, we can actually check whether you've got those antibodies, and therefore you've got immunity. Now, so far, the antibody tests that are being put through their paces in Oxford that were bought by the UK government have not proven to be accurate enough or effective enough. They do detect antibodies, but at the moment it looks as if they're detecting them only in people who had a really severe illness. But actually, you're not in any doubt that those people had the illness. It's actually all the people who had mild COVID or never got tested at the time that we need to test. So we actually need a test that's accurate enough to pick up antibodies even when the amount is smaller. Now, the other question, which is, do you become immune to coronavirus and do you maintain that immunity? That obviously is something that we're going to have to watch, because coronavirus is actually a family of viruses. It includes the original SARS from 2002, but it also includes the common cold, which none of us have ever managed to become immune to. So where in the scale of things does this sit? And so if we've been infected, do we become immune? And how long does that last? The suspicion with coronavirus is that even if you develop immunity, it may only last a matter of months, maybe a year at the outside. But, would it be enough to take us through next winter? And if you come up with a vaccine, can we come up with a vaccine to some important structural part of it that doesn't change, so that once you're vaccinated, you develop long-term immunity? That's just something that we don't know at the moment. And there are reports of people who had COVID, had proven COVID, became negative, and then have become positive again. They haven't got sick again, but yet the virus has been detectable. So the problem is, there's so much about this virus that we don't know. And the worry would be, when people talk about immunity passports and so on, whether that was on the basis of you having had COVID or even the antibody test, I think the worry would be that those people might be quite cavalier in their behavior, and therefore actually, if this doesn't prove to be true, they would undermine and perhaps spread it to others. And this has been the complete nonsense of risking a huge outbreak and an uncontrolled epidemic to achieve herd immunity, when we actually don't even know if herd immunity is something we can achieve by any means.
Yeah. We are seeing, for example, that Sweden is doing something different than Spain, for example, or Scotland. And what do you think about this kind of instructions from the Swedish government, for example?
Well, obviously, Sweden was following more a similar kind of line as the UK was, without any lockdown and without major social distancing. Where they felt they had an advantage over countries like Spain and Italy was that obviously population density is much lower. They don't have intergenerational family living, etc., the way that you would tend to have in the southern European countries. But my understanding, and you can correct me if I'm wrong, because I've not been listening to their announcements, but they obviously were seeing really soaring death rates. So my understanding was that they were actually looking at whether they were going to start following what other countries were doing. So I don't know what advice they have been giving out today or yesterday.
And finally, Dr. Philippa, there is a talk about, for example, from the European Commission President, a talk about accelerating diagnosis, the treatments and the development of a vaccine, for example, which could still take anything between 12 and 18 months. What guarantees do we have that the vaccine will work with these limits? It's safe. It is safe.
Well, I think when they are talking about accelerated access and registration, what they're really talking about is cutting through some of the bureaucracy that can actually take an inordinate length of time. What I would certainly hope we would not see is any shortcuts on trials of drugs or trials of vaccines. I think that would be very dangerous to do. I think it's critical that we are sure that anything that will be used in a patient, such as a vaccine or a drug, is safe. Obviously, with testing, it's looking at reliability, but you're not putting something into a patient. But we do need testing systems that are quicker, that can give us an answer literally in an hour or so that the patient can wait while you get that answer, and then you can decide where they go next. So I think it's more around cutting some of the red tape and bureaucracy. And obviously the advantage of the European Medicines Agency is when you go through that one procedure, that one licensing procedure, that will cover all of the EU. Obviously, the drug companies or diagnostic companies will unfortunately then have to go through a separate procedure to bring their product to the UK. And obviously what we're hoping is that we will not see a big delay in that, which we easily could, because obviously there will be additional costs and bureaucracy for them. So I think we do want to cut red tape, but we absolutely don't want to cut corners. A vaccine, as I say, I can't guarantee that we'll get a vaccine that works purely on the biology of it, but in a general sense, it would be wrong to be expecting a vaccine before next year sometime. You know, if it comes quicker than that, fantastic. But the idea that we're getting a vaccine in just a couple of months, unfortunately, that isn't going to happen.
Well, Dr. Philippa, thank you very much for your time. Thank you for your answers. And I hope Scotland, I'm sure Scotland will get through soon, and you will be fine.
Well, we all just need to do our best and remember the guidance and stay home and not break the rules. And you stay safe as well. Take care. Bye-bye.